What if you and your loved ones could experience care when, where, and how you need it? Well, it's called home and community-based healthcare, and St. Elizabeth Healthcare has been doing and thinking about this for 100 years. I'm Mary Rose Bacani, and welcome to Catholic Focus. With me in studio today, three special guests who can talk to us about how St. Elizabeth Healthcare has been impacting the future of healthcare in Canada. And these are Shirlee Sharkey, the President and CEO of St. Elizabeth Healthcare, Michael Decter, who's the Chair, and Nancy Lefebre, Senior Vice President of Knowledge and Practice. Welcome.
Thank you.
Now, before we begin our discussion, I'd like to take an overview of this phenomenal organization.
St. Elizabeth Healthcare is a remarkable agency that for over 100 years has taken the example of Elizabeth of Hungary and put it into practice. Royalty that becomes service. Service that becomes a call to holiness. Elizabeth was born in the year 1207 in Hungary, and she was from a royal family. And right from the beginning of her existence, she had a great desire to help the poor, because the legend goes that she was carrying bread to someone who was hungry. She had the bread hidden in her cloak. Who should she meet along the way but her husband, Ludwig? And Ludwig is rather startled and saying, "Where are you going like that? And what have you got hidden inside?"
And she let her apron open and a bundle of roses came out. So the symbol of St. Elizabeth Healthcare is the rose. And over the years, they have been providing health care in the homes for those that are in need. That has evolved over the years and has become a very important component of today's health care.
Well, I think for a person to be in their own home, it's so essential, quintessential, I would say, to getting better. Certainly, they're surrounded by their loved ones, and the atmosphere, the environment is very conducive to wellness.
The connection with Catholic Charities and making sure that the human individual is treated with every respect and dignity as they experience their illness or their frailty or whatever we're attending to.
St. Elizabeth Healthcare recognizes that we want to provide very holistic care, and we assume that spiritual health is very much of a piece and very much tied to physical health, emotional health, mental health.
We're the forerunners. I remember there, way back when AIDS was there in the 80s, we were right there because these people could remain in their own homes, and that's what we were able to facilitate.
The science revolution has impacted our care. The best practice guidelines have impacted what we do. And also technology is playing an increasing role in making our jobs more effective and more satisfying for us as nurses too.
I think St. Elizabeth Healthcare has really been pushing the envelope in terms of bringing healthcare online in an education form to share knowledge across different communities. In First Nations communities, especially across Canada, and our nurses within the organization have been able to grow their knowledge in community health nursing and personal support within their community work. So it's really exciting.
My mother was cared for by St. Elizabeth, and it made a significant difference to our family while she was dying. And we were able to be with her in ways that we might not have been if it hadn't been for St. Elizabeth. It is so values-based, and I think the Catholic roots and its heritage is what contributes to that.
And I can remember being a young boy growing up in the Archdiocese of Toronto and my grandmother coming to live with us in the last years of her life, and the St. Elizabeth visiting nurses coming to provide care. Sitting on the board these last several years has given me a real opportunity to see the organization at a different level and watch them grow and become the magnificent organization that they are today.
So let's talk about the organization and where you are today. Why phenomenal knowledge and care exchange? What does that mean?
Well, we like to think it's all about care that people receive no matter where they are. That can be in their home, in the community, in schools, in the park, in rural areas, in urban areas. And to make sure that that care and that service and that information is amazing for them, and that they really can have their needs met, can be part of the decision making that needs to take place in the home, and that their family can be part of what's happening.
So how is this different from, let's say, putting your grandmother in a nursing home or a retirement community? How's the care different?
Well, I think where the care is delivered is part of the difference. But you know, if I can say it, we may be 100 years old, but we have a very young heart and spirit at St. Elizabeth. And it's a spirit of innovation, and it's a spirit of trying to support people and to the degree possible, support them in living the life that they'd like to live, an independent life, a life in their own home and community. And yes, we do need nursing homes. That's not our part of the business, but we don't want to see the people we're looking after moving into a nursing home setting if they can remain in their home with support, because that's a far better option for them. It's a far better option for the community and the taxpayer.
Value proposition, I think that's what you call it.
Mm-hmm.
You want to give them all that care can be. So what is your vision of all that care can be? What is that?
Well, I think that the home is really a natural environment that fosters care that all can be, because you see one in their very natural environment. You are able to look at them from a holistic perspective in terms of physical, spiritual, and emotional care. And I think really create a phenomenal exchange within the home. You have a profound understanding of where the client is at, what their needs are, how they're interacting with their healthcare and the healthcare system. And I know we always say that as a healthcare provider, being invited into somebody's home, you are a guest in their home. And that changes the dynamic between the healthcare professional and the individual who's receiving the care. And in fact, it's quite a privilege to be invited into somebody's home in a time of need, whether it's the best of time or the worst of time. And that environment fosters client-centered care. It fosters a very therapeutic relationship, and it is really a special place where special things happen.
And we look at it sometimes as not just meeting one's needs, but actually exceeding the needs that you don't even know you may have. And that's really the magic of when you really are amazed and you go, whoa, I didn't even know I needed that. And now that I've received it, it's wonderful. That's the kind of phenomenal experience we're looking for.
And how do they know, like how can people access you? Is it something that's, are they referred by a doctor to you, or how does that work?
Well, there's a variety of mechanisms to enter the healthcare system, the home care system, either through the public system, through private pay, through insurances. People can call us directly. In each province, there are different mechanisms to get into the public-funded home care system. So on one hand, people say, well, that sounds kind of difficult and disorganized. On the other hand, there are many doors that you can go through to access home care services. So it could be from an individual calling to a physician referral and everything in between.
Now I know people are going to ask, is this an extra financial burden on me if I have home care, or does the government take care of this?
The government pays for a very big portion of home care, and I think that's the home care that most people utilize. But there are other payers. If you're injured in a car accident, it might be an insurance company, it might be workers' compensation, or you're able to pay out of your own pocket. So if you feel that what the government's paying for isn't enough for your loved one, or for some reason you'd like to just have more services, you're perfectly entitled to pay, and some people would have insurance from their employer that would help cover that.
Well, we'll talk a bit more about what home care really means, but first, I'd like to take a look at what some of your frontline nurses are doing. So let's take a look at a day in the life of two caregivers from St. Elizabeth Healthcare.
Alright, this is what I do every day. Drive back and forth to see all of my clients. My area is East Jerk and Leaside and Thorncliffe Park, quite a large area. And some days I do lots and lots of driving.
My mission is to treat every patient as a whole, not just look at the wounds or the disease that the client has, and to keep them at home as long as possible.
Good afternoon. How are you?
Well, I had 2 heart attacks last year, and they said they have to send somebody in to help me. So we sent Natalie to come in to give me a needle. Natalie came and we hit it off. We like her here.
Brenda's an amazing woman. She's had a lot of health problems, but she seems to cope quite well with my weekly visits. She also does have a personal support worker that gives her a bath twice a week, so that helps her out as well.
Actually, the bottom number is 80. So it's 180 over 80. Okay, so we'll follow up next week then. Good morning.
Hi, how are you?
Good, how are you?
I had an 8-star heart operation. I had at one time one hole that was 3 inches wide and 4 inches deep. And now I only have 3 little holes, which are just little tiny things now. And they took away my car.
They took your car away.
Been working with Florence for approximately 4 months now, doing wound care. And her wound has come a long, long way. It's almost at the point where it has healed and she'll be able to go on with her normal life.
Natalie, she's just wonderful. If I wake up in the morning and she's the first person I meet, she makes me so happy. I really enjoy being with her.
My hands are cold.
Yolanda's a young woman with a history of fibroids, and she had 10 fibroids removed. She's had major complications after the surgery, in which she's needed to go to the emergency department a couple of times, but we can manage most of the wound care at home.
Looks really good. Wow. Oh, well, it's nice not being in the hospital. And it's nice having somebody come in, and it's nice that I don't have to go to them.
It's probably still really sore.
Yeah, they didn't even take a painkiller before No. I mean, you know, you always feel a little bit more comfortable at home and stuff like that. I'm going to pass it on to him. Okay. I know that on Wednesday he has surgery, so...
From the age of 8, I knew I wanted to be a nurse. I got into St. Eliz actually after working different agency jobs. I wanted to try working in the community, and I actually started loving it because my daughter was young and I was getting home after doing the 12-hour days and I wasn't seeing her. She used to wait for me on the steps, and I said, I got to do something else. So I tried St. Eliz part-time, and after that, I haven't looked back after, 8 going on 9 years.
76. Very good.
Strong bone.
Huh?
Strong bone?
Talk about shot.
John is a patient who lives alone. He currently has respiratory problems, so he's on oxygen, and he's got peripheral vascular disease. So he's got some circulation problems to his legs. So we're going in, we're assessing his legs for circulation, for color, making sure that there's no swelling to his legs.
Slept well last night?
Well, I think I'm going to watch it.
Oh, okay.
There's no suction.
There's no suction. Okay. No suction.
With Leonora, she has gangrene, so the doctors amputated 3 of her toes. So with the vac dressing, what we're doing is we're increasing the circulation to the amputated area, increases granulation for that wound to actually heal up.
Yeah, well, you see, with the hospital, they discharge you. They don't keep you very long in the hospital because, remember, it's costly. And then the doctors say you're safer at home, too, because, like, you can pick up any kind of virus in the hospital.
Yeah, I patch around this area, so I'm thinking maybe it's that area.
I love my job. I enjoy being a visiting nurse. I get a lot of satisfaction like again, as I said before, seeing the patient when they're not well to when they're whole again, and when we discharge them, it's a good feeling.
So this kind of care that we've seen in the clip, you do this not only in Ontario, but other parts of Canada. Can you talk about this?
We're doing some very innovative work with First Nation communities, some 200 of them, which is supporting community health workers in those communities to be able to deliver a better quality of care, to be able to support them with e-learning, support them with a system called At Your Side. We're working particularly in northern Manitoba on a project to help reduce the number of foot amputations for people with diabetes, which is actually quite an innovative and pioneering approach, a partnership between St. Elizabeth and the First Nations and the Government of Canada to try and deal with a really dreadful situation in which the rate of foot amputations for diabetics in First Nation Northern Manitoba is 14 times the rate in the rest of the population. And we're trying to find ways of changing that reality.
Wow, and aside from e-learning, what other kinds of training do your nurses get? Like, how do you monitor their work with your clients?
Well, overall as an organization, we know that the quality of care that people receive in their home is as good as the quality of education and learning that we provide in the organization. So certainly from a strategy and from an investment, we ensure that there are all kinds of opportunities for learning and development. We have tried to be really innovative because our workers are very mobile, whether they're therapists, personal support workers, or nurses, and we have to have information at their fingertips. Now with the opportunity with technology, it has become much more helpful for us with cell phones, even with GPSs to get them to the person's home, along with all of our e-learning, which is really the clinical information, so that we like to think that although they may be alone in the home, the information they require is literally a touch away or a telephone call away. Nancy, our best practice guidelines is another area that you may want to speak to.
Certainly, I'm looking at basing all the care that we provide on best practice guidelines or the best evidence available is certainly something we strive to do, and have a philosophy around caring to know. So we care to know, for example, that the clients or the patients have the best information and evidence possible to be making decisions about their own care and participating in their care. In treatment, we look at it from the healthcare professional in terms of how do we get the best evidence to our staff so that they're providing the best care possible, and how do we use evidence that from an organizational perspective to ensure that we're making the best decisions to have the best client outcomes. And much of this information and access to evidence is done through a virtual mechanism such as our At Your Side client and colleague. And we see the results in terms of better patient care, good client satisfaction outcomes, as well as our healthcare professional outcomes as well.
What's really been interesting also is to see our involvement in other countries. We've been doing work with the National Oncology Program in Trinidad, where again we're building capacity for nurses to go out into communities in Trinidad and make sure people can receive home care services and palliative care. And so we're sharing the expertise and the privilege and resources that we have had in Canada in Trinidad, so that they can move forward very quickly with innovative approaches and great standards of care so that people can get the full continuum of services. That's when it's really fulfilling, that you see not only the strength of what we've been able to develop in Canada, but how we can share that to other countries and other communities where they can have access to that type of intervention.
Well, it's really incredible work that you're doing, and I'm sure all our viewers are grateful for your 100 years of existence. And I'd like to share with them some highlights of the key events of this past year's celebration of your 100 years.
Davis from 98.1 CHFI from the Aaron and Mike in the Morning Show, and welcome to the official launch for St. Elizabeth Healthcare's 100th anniversary Yay! Care to be amazed! I am pleased to present the Daily Bread Food Bank with 10,000, that's 10,000 loaves of bread from Stone Mill Bakehouse. Thank you, Gail, for your team, for being a leader in Toronto's fight against hunger.
Celebrating 100 years.
Oh, wow.
So,
That's a long time.
there's one for you.
Thank you.
You're welcome.
Happy birthday to you. Happy birthday, dear St. Elizabeth Healthcare and these guys. Happy birthday to you. Hey.
Imagination Ball actually came from our brand, I guess, Care to Imagine, which is the tagline for our foundation. We believe that with imagination, anything's possible.
The purpose is a fundraiser for Care for the Caregiver program, a program we started about 5 years ago. There are over 3 million caregivers in Canada and quite a few in Ontario that we need to support their loved one effectively at home.
It's very significant for us because it's our first big fundraising event for the foundation.
This program and the staff of St. Elizabeth gave us a chance to stay focused on Kathleen, her care, and our family. We were offered a lifeline because the foundation had the resources to fund and to deliver a charitable service like this. And from my whole family and Kathleen, we thank you for your love and your care and your kindness. Thank you.
Our story is shared through my daughter, Kathleen, who passed away on September 17th last year. And St. Elizabeth Healthcare had been involved with us for about 3.5 years, and it enabled us to stay as a family and keep Kathleen at home. So that was really important for us.
The continuing quality of care that we can provide, and just that charitable side, once again, it's so important, and it's so nice to see it go right back into all of our communities, and just proud of being part of that team to be able to deliver that care.
Who's been painting my roses red?
So tonight we see the themes of imagination, wonder, and amazement. And all of these come to life through the story of Alice in Wonderland. In the Adventures of Alice, the term Wonderland refers to a marvelous, magical place. At St. Elizabeth, we know this place too, and this place is known as home care.
Gee, I've been here 31 years of that 100 years, so I really feel part of it. I think it's a very exciting place to be.
I've been with the company for almost 10 years, so I'm just looking forward to the camaraderie, the networking with some of my peers, and seeing everyone again.
So when we're doing moral theology today, when we're doing ethics, we're really talking about the whole person, and I think that's the approach that St. Elizabeth Healthcare takes too. And congratulations once more to St. Elizabeth Healthcare on their 100th anniversary.
Okay, and this healing connection acknowledges that we have our wounds, and the patient has hers, but the patient also has her own inner healer, and we can activate that in the healing connection.
My goal is really to get the caregivers to reflect on the way in which they are transformed through the work that they're doing with the patients that they're working with. and they in turn can transform the patients.
My hope is that you go away, you do some reflecting, you look at some of this stuff, you take care of yourself so that you can go and be present in the moment with people, and blessings upon St. Eliz as you go forth into the next 100 years. Thank you.
Today we come together in this historic basilica to celebrate the feast of St. Elizabeth of Hungary, and in a very particular way today to celebrate the way in which over these last 100 years St. Elizabeth Healthcare and all of those engaged in that great work have made the example of St. Elizabeth present here in our archdiocese and all of the whole of the community, the loving presence of the Lord caring for those in need.
I think St. Elizabeth comes with certain principles and qualities that, you know, I'm able to implement in my profession. That's what makes it very special for me.
I think the impact that St. Elizabeth has had on the community as a whole is acting as a leader, in that we are advancing the practice, we are making the public more aware of our role as community nurses and the potential that we have of delivering nursing care in the community and making it more satisfying for our clients as well, who I think really would rather be home than in the acute care hospital.
It's just a truly amazing organization to work for, and I really value the type of work and care that we bring to the communities that we share with.
So you've had a wonderful year. What do we look forward to for the next 100?
Well, I like to think that all that you can imagine and all that will amaze you will be realized in the next 100 years.
I think continuing to live the mission of helping the poor, the sick, the needy in the world, really looking to do things for people who are in trouble and have needs, and continuing that mission is going to be as important in the next 100 years as it was in our first 100 years.
And I hope that we continue to have the talent and the opportunity to nurture the talent that we're going to need to provide that wonderful care that's required for people in their home environments in order to improve outcomes for Canadians across the country.
Well, I'll be hoping and praying that this vision that you have will continue on for the next 100 years. And I'd like to thank you for taking this time with us. And I would also like to thank our audience for staying with us. And if you've enjoyed the show, let us know. Send us your comments, insights, or if you'd like to order a DVD copy of this or any other Focus episode, send us a note. focus@saltandlighttv.org. Once again, I'm your host for Catholic Focus, Mary Rose Bacani. We'll see you next time.